Well, 14 years ago, a diagnosis of prostate cancer radically changed GP Lee Nelson's life. He's here to share his story as part of Blue September Prostate Cancer Awareness Month. Lee, welcome to Good Morning. Thank you for joining us today.
Thank you, Brendon. Glad to be here.
Lee, let's talk about when you found out or when you were diagnosed with prostate cancer. When was that?
That was in 1997, so about 14 years ago, and it came as a total shock to me because it was just a routine PSA. I was in perfect health until I had this PSA, and then I realized just how sick I was.
Were you surprised with that result? I mean, did you live a healthy lifestyle, or what you thought was a healthy lifestyle?
I led a pretty healthy lifestyle, not what I do now, but a pretty healthy lifestyle, and I was absolutely blown away. I didn't believe it. I said, it must be a lab error. So I repeated the test, and it came back the same, and I had prostate cancer.
How was it being a GP, knowing and understanding probably a lot about this particular cancer?
Well, the first thing I did is I went and talked to the top 7 specialists in the United States, which is, went to the United States where the best doctors in prostate cancer happen to be. I talked to the 7 top doctors, and I got 7 different opinions as to what to do. So I then went to the medical literature, which I'd learned how to do when I was in medical school, and I read over 2,000 medical papers on prostate cancer and determined my own treatment plan based on the literature. But if I were a layperson, I would have been at a total loss as to know what to do.
So what have you changed to improve your life, and has it gone into remission?
My prostate cancer has been in total remission since my treatment.
Wow.
I was treated with radiation therapy and hormonal therapy and complementary medicine. I changed my diet radically. I changed my exercise program. I changed my stress reduction programs. I did a whole bunch of lifestyle changes to complement the medical treatment that I was getting. And I've been free of cancer ever since. Had I waited another year, I would have been dead.
Really?
It would have been untreatable. It had already escaped the prostate capsule, so the cancer was already starting to spread. At the time I had this routine blood test.
So when is the right time to have a blood test? I mean, we hear, as you know, when you turn 40 you should do it, but what if it's hereditary, it's part of the family? What age?
If you have a hereditary history of prostate cancer, or breast cancer for that matter, because there's a correlation between prostate cancer and breast cancer, I would recommend getting the first PSA at age 35. If there's no family history, age 40 for the first one. And it's not the absolute level of the PSA that makes a difference. Some people say, well, if it's under 4, it's normal.
Right.
But let's say that you have a PSA and it's 2, and the next year you have another one and it's 2.5, and the next year it's 3.
Right.
Already you're starting to, there's a problem. Somehow your PSA has gone up by 50% in 2 years. Something's probably going on. So it's very important to monitor the rate of change of PSAs. So just getting one isn't enough. You have to get them regularly.
So you get them regularly to follow up. You talked about alternative, or you use alternative medicine to go along with Western medicine. What type of alternative medicine have you been using?
Well, the biggest thing is diet.
Right.
Hippocrates, 2,500 years ago, said that let food be your medicine and let medicine be your food. And there's really a lot of truth in that. 90% of all cancers, including prostate, but also colon, breast, and a whole variety of other cancers, 90% of all cancers have a dietary link. So the best thing you could possibly do from an alternative preventive standpoint is to change your diet. Eating less red meat, less dairy, more fish. More.
We're in New Zealand. We live in this country where we produce a lot of meat and we produce a lot of dairy, and it's a staple part of everyone's lifestyle.
It is, but statistics tell us, Brendon, that people who eat meat 5 times a week have a 79% higher risk of getting prostate cancer than people who eat meat once or less a week.
Really? So you've eliminated those, you're probably not eating as much meat, you're eating a lot more fish and a
lot more fish, vegetables, fruits, nuts, specifically fruits like pomegranates, which have now been shown to specifically kill prostate cancer cells. Berries, blueberries are wonderful, wonderful food, and nuts. Those are the things that I've increased in my diet. I've reduced the amount fairly dramatically of red meat and dairy. The only dairy that I eat is a high probiotic yogurt, which I have once in a while, and I eat meat probably once a month.
Really? So basically, in terms of, you talk about the diet and changing the diet, did you have to change your diet radically, or were you eating reasonably well before that?
I thought I was eating reasonably well,
right.
but I did change my diet fairly radically. Like, for example, I've eliminated cheese, which I was eating a lot of. I substitute chicken cooked without the skin, so
right.
I don't have the fat content
okay.
as opposed to red meat.
What about supplements? Because we think about the soil and the soil content and then the nutrients in the soil content, what it was 20 years ago
Correct.
is completely, was a lot different nowadays. So do you recommend people taking pills or anything to sort of
Yeah, I don't like the word pills.
No.
But supplements. Yeah.
Supplements, yeah.
There are a couple of supplements that I think are very important. Our soil in New Zealand is depleted of selenium.
Selenium, yeah.
We feed it to our animals. We don't feed it to our humans. Don't ask me why that is, but humans do need selenium. So I think supplemental selenium is important. And the other one is vitamin D. Now, vitamin D deficiency has been closely linked with prostate cancer.
Right.
And what happens, because we're so concerned about preventing skin cancer, that we slather ourselves immediately about going out in the sun. Nobody gets sun anymore. Not nobody, but many people don't get any sun. And about half the population now have clinically low vitamin D levels.
Yes.
So if you are not getting enough sun, vitamin D is not expensive. It's a very cheap supplement, and 1,000 to 2,000 milligrams a day is the right dose.
So Lee, the real message, I guess, especially with Blue September coming up and you being an ambassador, is people, especially men, need to get out there and they need to get tested, get their prostate test. Don't be afraid of it, and stay on top of it and do it regularly.
Absolutely. The two critical things, two messages that I would leave for men is, number one, you need to be a bit more proactive as a man about your health, just like the women are about their breast cancer.
That's right.
Now, just because the prostate's tucked away and breasts are out there doesn't mean that you can't pay attention to it. So it's very important to get tested. And it's very important, just because you have a test that's, quote, normal, that you still need another one. You need to follow this up and have it charted regularly, because it's actually the rate of increase that will identify a cancer early. If you identify cancer early, prostate cancer early, about 50%,
wow,
Brendon, of the people who are dying now of prostate cancer, their lives will be saved just by testing.
Wow. Fantastic, Lee. Thank you so much for chatting with us today.
My pleasure.
You're doing a great job and a great ambassador and a great example for those people that do have that problem.
Pleasure being here, Brendon.
Thank you.